The U.S. president spoke today on the federal government's response to the pandemic. He also answered questions about those new restrictions that Evan told us about at the U.S.-Canada border.
I spoke with the Prime Minister, Trudeau. Very good relationship, obviously, between us and our two countries. And no tipping point. It's just that we want to isolate from the standpoint we don't want people coming into contact, because that's the way we're going to win this war. That is so important. And we both thought it was time. Now, it's not affecting trade. It's non-essential. It's non-essential crossings. It won't affect trade at all. And it was just something we thought would be good for both countries. Yes, please.
So let's bring in the CBC's Zulekha Nathoo. She's live from Los Angeles. So Zulekha, let's break down these new measures that we hear at the border between the U.S. and Canada. And what is the impact they're likely to have?
Well, this is a reciprocal and collaborative agreement. Both governments have said that, and so the measures are similar on both sides of the border. The U.S. president was asked at that same news conference you just saw about the restrictions at the border, and he said that he wants to limit non-essential travel. And he said what was essential is things like the military, movement related to the health industry. And that was a big question from a lot of Canadians as well. Will essential services be affected because so many people cross the border on a daily basis? The Detroit-Windsor border is a really good example of that. And the answer to that is no. Essential services, healthcare workers will not be affected by these new measures. They will continue to be able to traverse the border as usual. Donald Trump said that people who go back and forth for leisure, for restaurants, for shopping, that kind of thing, he wants to see a stop to temporarily. Goods will continue to flow, and that is so important to know on both sides of the border, because the supply chain will not be affected. People who are worried about their local grocery store not having enough there, it shouldn't affect that in any way. Fuel, food, medication, necessities will continue to flow as normal on both sides of the border.
And Zulekha, also the U.S. announced additional measures. Can you tell us about those too?
Yeah, this is really interesting because Donald Trump says that he's invoking the Defense Production Act. So that is a wartime measure from the 1950s. And in this case, it allows to increase the production of health-related products. There's been fears about a shortage, and there's also been some preliminary views that there might be a shortage coming soon when it comes to a lot of medical supplies, things like masks, gloves, hospital gowns. And so that measure, even though it's being applied to the health industry right now, can also be expanded to encourage businesses and companies here in the U.S. to prioritize what they're making and what services they're providing so that it's more in line with what the country needs at a certain time. So they are pretty wide sweeping powers. And interesting to know that on this side of the border, because Canada has also considered invoking its own Emergency Measures Act. The Prime Minister has been asked about that. He would have to consult with the provinces before actually doing that. And the federal government in Canada has said they're not there yet, but it is something that is not out of the question right now. Hannah?
Yeah, absolutely. That is something he said they were considering. Zulekha, thanks for the latest on this. We appreciate it.
You're welcome.
COVID-19 is an extraordinary challenge that requires an extraordinary investment.
That extraordinary investment equals $82 billion in aid, and that's in response to the COVID-19 pandemic. That was Finance Minister Bill Morneau, and he says it's the first phase of the government's plan to help Canadians and businesses cope with the fallout. $27 billion is earmarked for direct support for individuals and for businesses. Here's a live look at how the markets are responding, even as Ottawa and Washington try to reassure everyone. The markets couldn't control their fear. Trading had to be halted on Wall Street when intense selling triggered automatic circuit breakers again. This is live look at the Dow Jones in New York. It cratered by 1,300 points. It's lost 1/3 of its value in the last 5 weeks and is down to 3-year lows. I want to now go to CBC's Chris Ensing, who is near the Windsor-Detroit border on the Canadian side. We're talking about closing down that border, and thousands of Canadians cross into the U.S. from there every day. He has more on how people are going to be affected by these new restrictions.
We've been hearing all day how essential the relationship is between Windsor and Detroit. The international border, with the closure that's been announced, creates a bit of a problem. Usually people are crossing the border for social reasons. There's people who live in Windsor and go to Detroit to their local grocery store over there. Sometimes it's a little cheaper. They're also filling up their vehicles over there from time to time. There are people who are dating each other on opposite sides of the border. But we've also heard stories of parents who live in Windsor and children that live in Detroit, and they now may not be able to see each other because of the way this closure is being implemented. But there is that exemption for essential workers. And when we hear about that, we start thinking about the nurses, the healthcare people who live in Windsor and work in Detroit. There's about 6,500 people who make that border trip every single day into Michigan, and 2,000 of them are estimated to work in the healthcare industry. So these are people on the front lines. America, frankly, can't afford to lose those people because of how important they are to the healthcare system and battling the COVID-19 crisis. But the other big thing that's happened here as well, and this is huge for this area, is the announced temporary suspension of production at General Motors, Ford, and FCA. That's a big deal for our region here. The trucks that cross the bridge, 9,000 a day, they are carrying auto parts back and forth. But the people who are creating those auto parts, the mold makers, they've been asked to do something different. The head of their association is calling on them to start making healthcare supplies.
That was the CBC's Chris Ensing from the Windsor-Detroit border.